Tony Brown-Arkah knew exactly why people in his line of work go to jail. He explained it to a federal informant on camera. That's why they go to jail. That's when the government busts them, he said, describing competitors who paid illegal kickbacks and billed for medically necessary services. You'd think that a man who could articulate the theory that clearly might reconsider his own operation, but you'd be wrong. On May 22, 2026, a federal jury in Brooklyn convicted Brown-Arkah, 78, on 19 counts: conspiracy to commit healthcare fraud, 12 counts of healthcare fraud, conspiracy to distribute narcotics, 3 counts of narcotics distribution, conspiracy to pay and receive kickbacks, and 2 counts of receiving kickbacks. He and his co-conspirators caused over $52 million in false claims to Medicare and Medicaid. Here's what he built. He owned American Medical Centers, a Brooklyn clinic nominally providing substance abuse treatment. The treatment was Suboxone, a Schedule III narcotic for opioid use disorder that, per trial testimony, also has a very active prison market. Inmates boil it and drip it into their eyes. Prescriptions were signed by a Florida nurse practitioner who never saw or spoke with the patients. Patients who tested negative for Suboxone in their labs, a significant indicator that they're diverting the drugs, received new prescriptions anyway. Drug dealers operated openly on the clinic steps. If a patient didn't actually want the Suboxone, no problem. Brown-Arkah's staff directed them to a van parked outside where they could sell their prescriptions. Brown-Arkah, who is not a licensed medical practitioner, billed Medicare and Medicaid for office visits in which he was the only staff member present. He paid cash kickbacks for patient referrals, including payment captured on undercover recording. He collected kickbacks from a lab for ordering medically unnecessary tests, concealing the arrangement behind a shell company and a sham contract he'd fabricated to make the payments look legit. A few things for you to consider. 1, the scheme ran long enough to produce $52 million in fraudulent billings. Some fraud collapses quickly, some runs for years. 2, the shell company and sham contract didn't actually conceal the laboratory kickbacks. They documented them in a slightly different format. 3, Brown-Arkah apparently understood exactly how schemes like his get prosecuted. The lesson isn't that he was reckless. The lesson is that understanding the risk and deciding to stop are 2 entirely different things. For most federal prosecutors, the distinction doesn't matter. This brings our Fraud on Friday series to a close. I hope you enjoyed it enough to remind yourself, well, daily, to stay clear of any scheme that seems too good to be true. And yes, there will always be more fraud. We just won't be unpacking it so publicly. Of course, if you need legal counsel to unpack your own potential arrangement, reach out. One last takeaway. If you learned anything from this series, it's that it's best to heavily vet any arrangement before embarking on it. Take care.